I mean, rest is BSc, MSc, PhD in botany, and now she is head of the department. Both of them are gold medalists. So it's like normally, my elder sister, she stays a bit far. We start within 5 minutes, 2 minutes, 1 minute. Start in 1 minute. I mean, when we three meet, so then no one is doctor, no one is lawyer, no one is head of the department, no one is principal. I mean, the Rakhi which she prepared specially with my name on it. Arre baap re. Yeah.
Sir,
Yes.
sir, are you tied with Apollo Hospital in Mumbai?
Not directly. Why? You got any work? Because I do have some contacts. You want something? Have you tried with Apollo Hospital? Uh,
No, sir, nothing like that.
uh-huh.
I just asked you generally.
Okay. Vikrant, I uploaded. Yes, it was my fault because one of you, when sent me the mail, I in fact missed to upload the thing. But yesterday I have uploaded it. You just check it.
Yes, sad
Book
message.
book मैं भूल गया यार. Book मैं भूल गया.
It's okay, sir. It's okay.
There is some work going on in the house. तो मतलब after lecture the role changes. मतलब वो झाड़ू काटना, वो सब साफ करना, that becomes the role. I stay alone. Yeah. Not able to see last lecture's PDF. Wait. Is it uploaded? Let me check. हाँ यार, मैंने just देखो ना. I folder तो it is showing day 8 radiology basics वाला. That file is there. Just check it. Is it there? Or if it is not there, I might have to re-upload it.
Yes, it's there.
It's there, no?
Yes, sir.
And I just check it. It is there.
Yes, I found it. It's
Found
here.
Today's student count is less. That's right. I was also, Radhika, that's what I was wondering.
So because of Raksha Bandhan.
हाँ तो रक्षाबंधन सबके लिए था.
हाँ.
Hmm.
But sir, हम आए क्लास में आज भी.
That is so good on part of you.
Sir, I told everyone to sit outside and not disturb me.
सर मैंने तो फंक्शन ही आगे स्किप कर दिया. लेक्चर होने दो पहले प्लीज.
Very nice. अरे माई एल्डर सिस्टर तो शी सेड कि आज मैं तेरे स्टूडेंट से बात करती हूँ. मैं सबको बोलती हूँ आओ आज छुट्टी. उन्होंने कहा चुप.
In my house, there is no brother or sister, so I'm alone, and I'm really happy spending time with my lectures.
No, Jayesh, I don't have my own clinic. I train Division 55 commandos and GPA, Gujarat Police Academy. I'm TOT trainer of trainers. So I teach those police walas, those who are inspector and above the level of that. Then they train sub inspectors and constables. And plus Ahmedabad airport, that is national, and that is domestic and international airport. The entire security and the drone technology that is handled by me. All of these things, they are service to the nation, free. So it's been say many years. So whatever the money which they give, that automatically goes to those bachas or the kids of those soldiers who sacrifice themselves on border. So I don't know that who is studying. So, but recently that there is one Colonel Shekhawat. He said that 267 students they took the education till date, and now they are very much eager कि किसने हमें पढ़ाया. I said नहीं, वो इनको पढ़ने दो. Don't disclose. मतलब ये अभी किसी ने मेल भी भेजी थी एंड कि why you are not practicing. नहीं प्रैक्टिस तो क्या मतलब प्रैक्टिस तो करते हैं ना. अच्छा, can we have that session on every Saturday for 10 minutes only, giving exposure to those kind of. हाँ हाँ अरे विक्रांत अभी तो सी मेरे ख्याल से नेक्स्ट 10 दिन में ये अपना जनरल एंटमी खत्म हो जाएगा ना. एंड देन व्हेन वी स्टार्ट तो it's like for every topic we'll be discussing some case only. We'll start with discussion of some case and then we'll go to the topic so that
Okay,
you
sir.
automatically know that yes, this is something which is to be learned today. Chalo, let's start our today's topic because आज का topic ऐसा है, we'll be dividing it into two parts. Right? So the topic is joints. We'll be talking about joints. Almost everything has been pre-written to save time. So in joints, say the word either came from the Greek or Latin. Greek, so it is called as arthros. That's why it is arthrology. Right? Arthrology means logy means science. It is the science or the study of joints. In Latin, it is called as the articulatio, or it is also called as the junctura. These words, they will be coming very frequently when we'll be discussing head and neck. Right? So as such, remember arthro or articulation. Articulation means where things join, right? So that is called as the joint. Juncture means where they meet. So that is what is called as joints. So these are the words which will be coming across more frequently. There is one another word which is called as the syndesmology. Logy is science or the study. Syndesmo is the combination of joint as well as the ligaments. Right? So where we'll be studying both the things together. In one of the classification also, you'll be getting this, that when we'll be talking about joints and ligaments together. Remember, whenever we'll be talking about joints, the concept of x-axis, y-axis, and the z or the z-axis, that will be coming very frequently. Many of the joints which will be working only on one direction. There'll be very less side-to-side movement. Say, for example, your knees, right? The side-to-side movement, that is very less. If you try to do it more, either it is painful or it is damaging, right? The way it is said that many times in gym you'll be watching that people take heavy weights and then they go for side to side. Sorry, it is one of the worst exercise not to be done because our vertebrae, they are for very proper alignment, right? They are for very proper alignment. This alignment, right? Its main function, this is intervertebral disc. Main function is flexion and extension. That side to side, when you try to go with the weights, right? So that is very dangerous. Instead, you can go for the twisting movement because the twisting is allowed for side to side. That is the oblique if you want to develop your abs, right, the obliques, so then the best is do the crunch, partial crunch, right, and then raise the feet and then go for that cycling. I do have that thing in mind, the live fitness session. Yes, we'll do that, right? I'll get two cameras, right? We'll mount them and then we'll do all the exercises, right? So at that point, I'll tell you well in advance. I would say that you also go in some of the some gardens. So it is like if I'm running, you also start running, right? I'll run with the camera. You also run. We'll deviate from the topic. Otherwise, say there is one very interesting topic, that is there are some 8 or 9 criterias which you should try to fulfill. Very difficult, huh? Very difficult criteria. But out of those 9, I was able to fulfill only 5. Right, 4th it was difficult. The rest of the 4 they were very difficult. करते हैं बात बाद में. So this is called as the syndesmology, that is joint plus ligaments. Right, that is the science. Now in this, there are 2 types of joints. One which is movable and second is immovable. The easiest classification, there will be several classifications which we'll be discussing today. So the first classification is easiest classification, movable or immovable. Movable makes sense. Any joint which is moving, right? When the subject, when we can move the distal portion. So it is movable. In what axis? In any of the axes, but it is movable. Immovable means they just cannot move. Example, fontanelli, right? Fontanelli is what? So that was the skull, right? That is the skull. So over here, this is a joint, no? Right? When the frontal is attaching with parietal bone, this is the frontal bone, this is the parietal bone. Frontal and parietal, they are joining. It is a joint, but it is immovable, right? We can't move portion of the head. So it is fixed. So that's why they are immovable. So fontanelli, that was the space, right? That was the space over here. And that's the anterior fontanelli, just in red color, never palpate. Fontanelli is a gap. Right? This is a gap in kids, in newborn, and it is very thin. Just underneath there is brain. That's why it has been written. It has been said that never palpate, because we might damage the cerebrum. Right? It is just underneath, so it should never be palpated. Weight waste, हाँ तो सभी अपने ना सब will take all these. You have sent some reports. By what देखना पड़ेगा. Still, कुछ mails बाकी हैं. I'll see that. हाँ. The second classification. Now we are moving on to the second classification. The second classification is based on the structure. This is what is called as the structural classification. Right? Then there'll be one more classification which will be based on functional classification. And then there'll be classification which will be based on regional classification. And then the classification as per the bones. Now you can see that so many types of different classification. We are going into this detail because when the bone comes into your hand, when knee joint comes into your hand, when you say, okay, these are the 2 joints which are making the joint. These are the 2 bones which are making the joint. So that joint, what type of structure it is, what type of function it is, in which region it is, and which type of bones are involved, which type of cartilages are involved. So that will give you the complete picture about that particular joint. Advantage, when you'll be learning the pathology, you'll be knowing instantly that why rheumatoid arthritis, it occurs into distal joints. Why it is not occurring on other joints. What happens why the knee injury is the first injury when someone starts becoming overweight, right? Though it is such a powerful joint. So answer to many of the questions you will be able to see. And then next time, I'll be showing you some of the very typical x-rays of common conditions. Say, for example, osteoarthritis, right? Osteopenia. Osteopenia is that those whose D3 levels, they are less than 10. So that means the bones will be so thinned out, you can take the x-ray. So I'll show you the normal x-ray and then I'll show you the another x-ray. We'll keep both the x-rays together and instantly you will know that, yes, this is where the lucency, right? There'll be the difference in the lucency. It will look more dark. It will look more black. right? Not white. Because white means what? White means the bone was so tagda, so strong that it was able to stop the X-rays. But if the bone is very thin, X-rays, they were passing through it and they were making the image, X-ray plate, black, right? Nowadays, digital. Acha, those, listen, whether digital or analog, right? The plate, what I'm talking about, plate, right? Plate means X-ray plate, जो आपके हाथ में दी जाती है. I know nowadays it is digital, but the concept remains the same. In the digital X-ray, what they do is on the back panel, when what is called as the X-ray tray, right, or the X-ray cartridge, it is basically charge coupled device (CCD), right? It is a charge coupled device. So when the X-rays they fall on it, the principle remains the same, and then it goes into the digital chamber, right, digital analysis, and then it generates the image. But basic principle it remains the same. I would just compare it with कि पुराने cameras थे in which you were supposed to roll the load, मतलब load the roll, right? Roll. Then 1, 2, 3, मतलब 12 photo, 36 photo. So that was the roll which kept on moving, correct? You might not have even seen those cameras, but after completion of that roll, photographic roll, you have to send it to lab, and that lab wala will develop the negatives, and from negative you have to put it into the projector, you have to put it, expose it, and then the development of that physical pictures or the physical photographs. Now the technology has changed, but the basic thing remains the same. Even if you go for, say, Canon 5D Mark III, Mark IV, right, in which the camera is costing more than $6,000. But the difference is देखने में तो same, whether it is 7D or 5D. In Canon, the rule is as the number decreases, its cost goes high. Canon 1D, that is mammoth cost. So, so when what I was telling, it's CCD, it keeps on becoming bigger. Charge coupled device, that sensor, that becomes bigger. And that gives you the entire accuracy. Right? That's the difference between when we go for those professional cameras and when we go for these iPhone, yeah, any of the phone cameras. They are fine, right, for reasonable photography. But when it goes to those professional cameras, the game is entirely different. We'll talk about that also afterwards. But this is how the classification really goes. So this classification would really give you the understanding. It will give you the understanding about various how joint can be characterized by various types. Right. So in structural as per formation, and within a minute we'll be coming in detail about the structural formation. Functional means moving, slight move, or freely movable. Now here we are now going into more detail. Whether there is absolutely no movement, there is some movement, and there is absolutely free movement. Regional, it is the easiest: skull, vertebra, limbs, right? That is how we divide. As per bones, the joint is formed. The joint is formed between, say, two bones. So we'll be calling it simple joint, right? When the when the joint is formed by more than two bones, now more than two bones, just simply more than two, right? So say for example, wrist, we have got those 8 bones, right? It is forming that completely multi-angular rotational. So it is called as the compound. But then comes the complex. The complex is like when there is presence of intra-articular discs. It means that this is one bone, and this is another bone, and in between there is a disc. Say for example, knee joint. The knee joint will be calling it as a complex joint because it has got the in that in between the two joints there is intra-articular disc. Not every joint will be having. Some of the joints they will be having just the fibrous tissue. It will be just fibrous tissue. But when it has got specific disc, then it is a complex joint. Complex because it is this disc what makes the whole thing into several compartments. And then it becomes vital for the disc because God has put the disc in only those areas where there is heavy friction, heavy weight, or heavy pull. Now, this is a weight bearing. Say, for example, knee joint, it's a weight bearing. Now, I asked, means you have sent the X-ray, right? I saw the X-rays of your mother. And yes, as I told you, there is some decrease in the disc space between tibia and this is femur and the tibia. Well, there is decrease in the disc space, but it has not gone absolutely. So that is where there is possibility of some conservative treatment. Today I'll answer your email. I know you sent it since 3 days, I think. Today I'll answer it.
Sir, can you once again explain the difference between simple bones and compound bones?
Simple and compound is in simple bone when only two bones are making the joint. And in compound, when more than two. So, for example, in wrist joint, so many small bones, they are making the whole area. Right? Say in
Okay,
some
sir.
of the cases, there are three bones which are meeting at one point. So they are all called as the compound. Two bones means literally two bones, bas or koi nahi. Say for
Okay, sir.
example,
Thank you, sir.
manubrium and sternum. So bas, only two bones, right? Then comes the structural. This is the most important. Fibrous, cartilaginous, and synovial. Out of which synovial, that is vital, most important, and most complex. But we start with fibrous. Fibrous is where it is joined by fibrous tissue, obviously, right? Sida sada. Now, when it comes to this fibrous, say fibrous, fiber itself. So fibers, they are like inexpandable slings. मतलब दो जॉइंट है मतलब पर बांध दिया उनको फाइबर से. So that's why they are immovable. This is the characteristic of it. They are immovable. So what type of immovable joints do we see in our body? We start with sutures, skull, right? In skull, there are several types of sutures, right? But sutures basically, whether it is between parietal bone and frontal bone, between two parietal bones, or between parietal bone and the occipital, which is behind, right? These are parietals, these are temporals, these are frontal, and backside is occipital. Right? अभी नाम सारे याद ना रहे तो भी we'll just have a look at those images also, so याद रह जाएंगे. But कहने का मतलब कि in skull, when the two bones meet, the skull, we don't move the skull, right? It is immovable. So that is one. Why those sutures are there? अगर जो skull को move होना ही नहीं था तो why the sutures were given? Sutures were given because as the age increases, as the brain size increases, the skull has to expand. And that's why the sutures were given. As soon as the size of the brain is fixed, all those sutures, they close. So then the head of the that particular person, the size of the head of that person, that is fixed. Brain size is fully fixed, and then all those sutures, they start closing. Right. So here it is, the skull, fontanelli, and this fontanellis, they close at 18 months. Right, those fontanellis, that is anterior and posterior fontanelli, they close by 18 months. So these are the sutures which are immovable. The second one, what is called as the syndesmosis. Syndesmosis. Syndesmosis is where the joint is formed, immovable joint which is formed between two bones. There is not much of the movement. Say, for example, tibia and fibula. So in between, this entire space is filled up. So that is what is called as the interosseous ligament. So there is not much of the movement, right? The function of interosseous ligament is that under any circumstances, just keep these two bones together. Right? They should not run away. So they should remain together. So that's because even say tibia is a strong bone, fibula is a very thin bone, and then muscles, they will be getting attached to the fibula. So what if those muscles, they work and they peel the bone on one side? No, that will not happen because that interosseous ligament, which is very tough, very strong, is keeping the fibula and tibia together. Similarly, radius ulna, right? So radius ulna in the forearm, when we have got radius, when we have got ulna, so in between there is interosseous membrane, right? Interosseous membrane. Knowing interosseous membrane is important from that concept that many of the blood vessels, many of the nerves, which will be into the posterior compartment, and then they pierce and then they come out into the anterior side. From where will they come? there are only two options. Either they wind around the bone. Now, when they wind around the bone, it is not the best of the option. There are some nerves, there are some arteries which will be going. Say, for example, radial groove, right? Radial groove. There is something what is called as a radial groove. But that radial groove you'll find in humerus. There is one thick, big bone, right? So the things will be winding around and then they'll be creating a tunnel onto the bone, and through that tunnel they will be passing. But when we have got this badhiya interosseous membrane, so these vessels, they will be piercing through and through, right? They'll be piercing through and through and they will come on the other side. So that is the interosseous membrane. So it becomes interesting to know that which blood vessels will be piercing the interosseous ligament or the interosseous membrane, right? So that is one part. So that is called as the syndesmosis, right? And the third one, this is called as the gomphosis. Gomphosis means gums. Basically, it is like peg and socket. Peg and socket means जो golf खेलते हैं तो there is it's like this, right? And then they put a ball on it and then the ball is hit. Correct. So this is what is called as the peg and socket. So this peg and socket, this thing is called as the gomphosis. The best example is gums, right? Where the teeth they are inserted. So now it entirely depends upon the gums, onto the gums. Just a general question. How many of you brush your teeth before you go to sleep? Morning में तो सब
Yes,
करते
sir.
Yes, sir, twice a day.
Yes. Thrice a day.
हैं. चलो अच्छा है, good one. Many of you. I tell you one very sasta thing, एकदम सस्ता, right? I always say that if you follow this, तो your dentist would die of hunger. भूखा मरेगा, right? He will never get anything from you. And that is, it is in English, it is called as ilam, but पिटकरी इतनी सस्ती मिलती है कि वो दुकान वाले ना रखते नहीं है, प्रोविजन स्टोर वाले, बोलना पड़ता है. This much packet will cost 10 rupees. एक ये प्रिंसिपल करना, एक ग्लास आपका, it has to be the कांच का ग्लास, right? Put one piece of this fitkari and fill it with water. Fill it with water. सुबह रख दो. शाम को, मतलब रात को, before you go to sleep, just do some simple gargles with it. वापस पानी भर के ढक के रख दो. In the morning, once again you do it. You'll be surprised by the strength of your teeth, because fitkari or the elam is such a good thing. And in advertisement, that is, they say, yes, this toothpaste is having this elam. What nonsense. Matlab, the amount of elam, it is so less into that toothpaste, right? So it is not going to affect. Plus it is with the foam and everything. While over here, this is raw. In 10 rupees, you get this much. 100 रुपए के लिए तो 5 साल चलेगी. It is that good. Right? And it's so easy. Just का taste जो है, it is not that very romantic. Oh, you do that? Very nice. Good, good, good. So that is gomphosis.
Sir, even alum is good for skin, no?
Alum is good for skin. मतलब इसीलिए पता है जितने आफ्टर शेव लोशन होते हैं, राइट? मतलब जैसे यार 2500 रुपए का, 3000 रुपए का, डैश ऑफ एलम, मतलब सुनने में अच्छा लगता है, वाह क्या बढ़िया, राइट? ऑन इंटरनेशनल एयरपोर्ट्स दे मतलब अच्छी अच्छी बातें करेंगे स्टाइल में. एंड सर देयर इज अ डैश ऑफ लेमन. अरे ऐसा बोलना, मतलब उसमें जरा सा दाना फिटकरी का डाला है. बट दे चार्ज अ बॉम्ब. इतना चार्ज होता है. यस, फिटकरी मतलब आफ्टर शेव, जस्ट वो थोड़ा सा पानी, slightly warm, you rub on your skin and see how good it is, because it is one of the best antibiotic. अरे हाँ, दोस्त, वो जिसने वो हाइपर पिगमेंटेशन वाला भेजा था, right? This is one of the thing which, because you have taken almost so many medicines and so many treatments, right? So आज मैं आराम से मेल लिखता हूँ, because it is बहुत लंबी मेल होगी वो, as I have to write so much. But one of the things which you can try immediately is it has to be a warm water, and this is for even everyone. If you are having those acne, pimples, वगैरह हो, and as such, if you want to keep your face good now, तो गर्म पानी उसके अंदर put some this alum, take cotton and then clean it. You'll find that the face will start looking so good. So on to the sutures. We start with, so just for the कि कहाँ पे है, here it is, right? We are talking about fibrous, right? This is where exactly we are. पूरा coordinate देख लो कि where exactly are we moving. We started with joints. In joints, the first classification was just the movements, whether it is movable or immovable. The second classification, which is the structural classification, as per formation, which we'll see, functional, regional, and as per the bones, right? They were simple. On to the structural classification. Structure means किससे बना है? Fibrous, right? Fibrous means it is immovable. In immovable, there are sutures, syndesmosis, interosseous, and comphosis. So now we are focusing on sutures, right? So you got it? It is like over here, we'll make, here it is. This is the complete brain map. So after the end of today's session, I'll tell you I'll give you some homework. Chota sa homework दूंगा. It would be, and this is the homework which you have to repeat it at certain interval. So it will keep you amazingly accurate. So going back to our point. So we are discussing sutures, which was part of immovable, right? Which was part of the fibrous type of joint, right? So fibrous are immovable. So in suture, the plain suture, सीधा. So this is the outer plate, this is the inner plate, and then there is a vertical attachment. That is what is called as the structural membrane. This is सीधा साधा simple suture. Where do you find it? You find it here. This is a nasal bone, right? So ये जो है ये आपका nasal bone. Internasal, between two nasal bones, this is a suture, internasal suture. This is a tough structure. It is not going to move. It just forms the bridge of the nose. This is called as the bridge, right? It is called as the bridge of the nose. But this bridge of the nose has been made. This is called as plane, Plane, plane suture. Next comes cirrate. Cirrate means notched, right? कुछ जो छुरियां होती है, तो they are with these serrations. These are called as the serration. Right? आरी जैसे होती है. Big type of example, interparietal suture. Interparietal, between two parietal bones. Right. So here it is, right? Over here, this is a frontal bone, correct? That's the parietal. This one is parietal. This is the right. This one is the left. क्योंकि ऊपर से देख रहे हैं. And it is this suture, this one, right? So which suture it is? Sagittal suture, right? So this is a sag suture or the sagittal suture, and that sagittal suture, we call it as interparietal, right? So that is a serrated type of suture. Okay. The next one, squamous. Squamous means flat. In histology, then we'll see that these are the type of cells whose height is less as compared to the width, right? So these are the squamous epithelium. So squamous means straight. So over here, these are also same type of suture, right? But the difference is that between the two plates, that structural membrane is oblique. Structural membrane is oblique. Where do you find it? Temporoparietal. Temporoparietal means this is parietal, so we have to go to the side over here. Yes, this one, right? So this one. So this is which bone? This is parietal, correct? This one is temporal. Correct. Temporal. Right. This one is occipital. Right. And we are right now dealing with this suture. So that is what is called as the temporoparietal suture. Got it? This is this suture. Right? That is the temporoparietal suture. So that is the squamous one, in which sutural membrane is oblique, while in case of say plain, it was straight. Denticulate. Denticulate means daat ki tarah. Denticulate means daat ki tarah. So over here, this would be the pattern, right? This would be the pattern. This is how they will be connected. So more or less, it is like those teeth, whether they are coming up or down, right? That sort of example. Example is lambdoid suture. See, that's the lambdoid suture. These are the lambdoid suture. See the difference as compared to this one, right? See here. Here it is completely zigzag pattern, right? Like this. While over here, the pattern is like it's not like this. Not so much of variation. Less variation, but as if these are all teeth. If you really draw it, like they are like teeth. So that is what is called as the denticulate suture. Example is lambdoid suture.
Leaf-like
The next,
structure, na sir?
हाँ बोलो बोलो.
Leaf-like structure.
Which like?
Leaf.
That's true. And the finally, this is what is called as the shindiasis. But these which अजीब name ना, so they are the कई बार examiners को इसमें मजा आता है. How much LM in one glass? ऐसा कोई डोज नहीं है यार, just normal, right? मतलब इतना सा piece.
Sir,
हाँ.
sir, for lambdoid, it is like parieto-occipital, kind of.
Yeah. It is actually, this is the parietal and this one is occipital. So parieto-occipital. But parieto-occipital will make only half of the lambdoid, right? Opposite side of parieto-occipital will make it complete.
Okay.
Right? So that's why lambdoid. So pura aa gaya. And then comes the shindiasis. Shindiasis is wedge and groove. Wedge and groove. There is a wedge, right? There is wedge and second bone also is taking the shape and it is entering into it, right? So there is a wedge. So these are some very special bones, vomer bones, sphenoid bones. These are the bones which are quite deep, right? So vomerosphenoidal, palatomaxillary, right? Inside, right? Palate, that hard palate. So palate and maxillary. So we'll see all these bones during our head and neck. But remember, such types, they are called as the shindiasis, in which there is wedge, one bone, and then second bone, it goes inside, right, in the form of wedge to give stability. For tan, which is the best face wash? सबसे बढ़िया face wash is हल्दी. बाकी जो पब्लिसिटी करते हैं ये हीरो हीरोइंस, वो कभी यूज नहीं करते. And then don't fall into the trap of this. There is one, kya naam? O2. They say that it is having active O2. But for males, and this is a D10. Right? Don't fall into trap of that. These are with some bleaching agents. Right? See, we are not going into any of the world competition of beauty. Right? So keep your skin good, healthy. But itna wo, I give you my example. My sisters, they are so beautiful. मतलब इतनी गोरी. आई ऑलवेज टेल देम कि भाई अपना काम तो ऐसा है कि अगर जो कलर गए तो पैसा पाछे वापस. मतलब आई एम गुजराती, तो in गुजराती भी से पैसा रंग जाए तो पैसा पाछा. So it is like color is something which is God given. कोई ज्यादा फर्क नहीं पड़ता. So don't worry much about D10. Don't destroy your skin, because afterwards it leads to those hyperpigmentation, and then the skin starts deteriorating. All these things, they will be affecting the collagen. नीचे एक layer है collagen की. If the collagen is affected, so then it will affect things badly. Now keep your face very clean. That is fine, right? जो अपना simple. And one more thing, you can use Savlon. वीक में एक बार use Savlon. Savlon is not very expensive, but Savlon is something which is used in all those surgical things or those surgical procedures. So you'll see that it is a yellow color thing. Brush मतलब उसमें मतलब the cotton swab लेके, and then it is clean. The area is clean. It is one of the very powerful antibiotic. So it will remove all those germs and everything, and will keep the face very clean. But you don't have to be obsessed with it. So दिन में 3 बार कर रहे हैं. No, do it once or twice a week is more than enough. Otherwise, your normal soap, that is more than enough. Savlon is not expensive. Turmeric and dahi pack, yeah, that is good. हाँ, एक ने आंसर पूछा, एक ने क्वेश्चन पूछा, एक ने आंसर दिया ऐसा. So turmeric and dahi, yes, that's right. Why do old people suffer from joint pain frequently, and what is the remedy for it? Now the thing is, like my chartered accountant who is just 43, he is the case of total knee replacement. There are cases which are like that at the age of 28 to 30, they are developing osteoarthritis. If you are not active, so then joints are going to get destroyed. क्यों? Because बाहर का खाना, that is adversely affecting your joints, adversely affecting your weight, and then the joints are getting weaker and weaker. One fine day or one bad day, it will go to that level when it becomes immobile. Pain इतना कि उठ ना सके. So 5 important things. 1, the nutrition. Keep your nutrition very good. That's why B12 or D3 कराने का main purpose यही था. And see how many if you have got, कितने लोगों का कितना कम D3 आया. Correct? So that nutrition is important, because the thing is, when you wrote that मैं तो एकदम अच्छा खाती हूँ. हाँ, but what is अच्छा? What is अच्छा? That बाहर का खाना, and if you are eating in some 5-star hotel, it is not necessarily अच्छा. They are एक ही चीज है, they want to sell their product. When they want to sell their product, so they want to make it so tasty so that you come back. Right? So they will bindas add all those monosodium glutamate and all other things which are allowed by the government. And why the government is allowing? Because it is a food conspiracy. They say it is one of the preservative and we can't bear the loss. आज का माल नहीं बिका तो वो कल खिलाने वाले हैं गरम करके. Right? So monosodium glutamate is important. But one of the other side effects for the monosodium glutamate is because it affects the ghrelin, it affects the brain. So it makes you crave for those things, right? So nutrition is one thing, very important. The second thing, what is called is the sugar, white sugar, addiction 40 times more than the cocaine. बिल्कुल cut it, निकाल के फेंक दो जिंदगी में से. But the moment you do this, मतलब अरे किसी का बर्थडे एक पीस तो खाया, right? किसी का बर्थडे है, those birthday हैं. Have you ever heard that in US किसी का birthday and they are telling कि चलो चलो, say for example I love पूरन पूरी, मतलब खाना खाने के बाद लड्डूस, right? I love that. खाना खाने के बाद देंगे तो भी मैं खा जाऊंगा. But have you ever heard कि US people they are telling कि चलो लड्डू काटते हैं? तो then why are we getting crazy कि चलो केक काटते हैं? नहीं ना, westernization. बुरा लगेगा कितने आप में से कितने लोगों को. But yes, मैं आई इंसिस्ट कि डोंट सेलिब्रेट द बर्थडे, हैप्पी बर्थडे करके केक उठा के लेके आए. इट इज लाइक अ कॉन्स्पिरेसी. इट इज अ ह्यूज कॉन्स्पिरेसी. मतलब घुसा दिया है यहाँ पे. केक नहीं काटा तो क्या बर्थडे. Why cake? It is something like a cake has got so much of maida and so much of sugar. So it is like if I am offering cake to you, तो then randomly मैं नाम ले रहा हूँ. मतलब I don't have, मतलब आपसे कोई दुश्मनी नहीं है, पर जैसे randomly नाम आया पूजा या कोई भी आफिया, राइट? तो मैं बोलूँ कि यार तू जल्दी जा इस दुनिया से, राइट? ईट मैदा, ईट शुगर, तेरा हार्ट खराब हो जाए. दिस इज व्हाट आई एम इनडायरेक्टली टेलिंग. सॉरी, ऐसा कुछ नहीं है किसी के लिए, बट दिस इज लाइक दैट मैसेज. मैदा एंड शुगर व्हेन दे गो इनटू द आर्टरीज, एथेरोस्क्लेरोसिस, क्या हालत होती है. एंड देन व्हेन वी स्टार्ट गेटिंग द पेन ना, तब लगता है कि अरे ये जो जितने पाप किए थे सबका कॉमन रिजल्ट. एंड इट कम्स एट दैट पॉइंट व्हेन यू स्टार्ट अर्निंग. सो पहले बॉडी को खराब किया, पैसा कमाया, एंड देन सेम पैसा spending into your own treatment. What's the fun? जिंदगी कहाँ जिए? So sugar, आज से I would say cut it. If you really want to save your joints. Third thing, salt. Salt कौन सा? अपना sodium chloride, right?
Pink salt.
इसकी जगह go for pink salt. That is potassium chloride. It would be very good. Fourth thing, water. Always keep 20 kilograms to 1 liter. So now
Proper
according
water.
1 liter per 20 kilogram of your body weight. If your weight is 60 kilogram, 3 liters, सीधा साधा सिंपल पानी, नो कॉम्प्लिकेशंस. वो छाछ और दूध और दही और ये वो जो ईमेल्स आपने भेजी हैं, नहीं, कुछ नहीं, सीधा साधा सिंपल पानी, राइट? प्लेन सिंपल वाटर, बॉटल भर के 1-1 लीटर की बॉटल भर के रख दी, राइट? इतना पीना है, शाम तक खत्म होना चाहिए. दैट्स इट. एंड फिफ्थ थिंग, वर्कआउट. Workout. If you don't use it, you lose it. Simple thing. If you don't use it, you lose it. Muscles नहीं use कर रहे, joints नहीं use कर रहे, you lose it. पूरा दिन बैठे हैं, then it leads to stagnation. It is going to affect. इतनी simple सी चीजें हैं. And if you follow it, देखो how nice your life becomes. अभी कुछ नहीं होगा, अभी तो you all are so good. कुछ कोई नहीं, because you are into the best state of your life. Your body is so efficient. But just in commando training, it is like you have to run 1.5 kilometers in 5 minutes. 5 minutes. Right? मतलब I'm a bit selfish. मैं वही चीज लिख रहा हूँ जो मैं कर सकता हूँ. Right? It is like 100 squats, single set, single session, एक के बाद एक के बाद एक, 100 squats. Yes, this I can do. Right? Then hold your breathe. Right? Breathe holding. Minimum 60 seconds. Minimum 60 seconds. इतना होना चाहिए. Right? Then plank. 5 minutes. I can do for 3.5 minutes. 5 minutes नहीं होता. But then even if you try, right, you will, and then stand on one leg. Stand on one leg. 90 seconds. Try to do these things. But automatically it will keep you fit. Then those who are into push-ups and pull-ups, so push-ups 40, pull-ups, slow pull-ups 5. Slow. Right? You don't have to just go on fast names. Absolutely slow, and then the chin above touch, and then gradually go. Then once again touch and go. These are not the things which are done by those commandos and the Navy SEALs. But this is why not to attempt it. Right? ऐसा थोड़ा ना कि only they can be fit. And being doctor, you should be more fit. क्यों? जब अपने अपर लिम पढ़ेंगे तो पुशअप एंड पुलअप्स के लिए आई शो यू द मेथड. एंड दैट डिवाइस इज कॉस्टिंग जस्ट 500 रुपए. 500 रुपए का. इट इज जस्ट प्लास्टिक विद दोज हैंडल्स. आपके पास, आपने देखा भी होगा, राइट? से इट हैज गॉट वेरियस ऐसे, राइट? There's all those various directions. So those handles you can take out, just put over here, and then you do push-ups. Then you can do it like this, this, and then you do it. Then you reverse, so there the triceps will be involved, right? So when you want to go for wide, to all those wide push-ups. Very सस्ता, कुछ 600-700 रुपए का आता है, easily carryable. So that can be utilized. So many messages. Shiraj, can I record because I'm traveling? Record तो अभी अब क्या करोगे? बस almost खत्म होने को आया. कोई बात नहीं. Next time we'll revise also. Even if you're traveling, don't worry. चलो. So this is what we talked about in classification, right? We classified as per the number of bones, then as per the function, then the regional, and the structural. In structural, we talked about fibrous. In fibrous, we talked about sutures, syndosmosis, and the gomphosis. In sutures, we talked about plain suture. We talked about serrate sutures. We talked about squamous suture. We talked about denticulate suture. And we talked about shindialysis. That is when there is like a wedge, right? Wedge and groove. Next, we move on to say this was fibrous, right? So I take you to this point. Here it is. So we finished fibrous. Now we are talking about the cartilaginous. Right? आज के लिए फिर बस cartilage करके आज का खत्म करेंगे. So here it is cartilaginous. Cartilaginous divided into two. Cartilaginous dividing into primary and the secondary. So primary is what? Primary is temporary. Primary is temporary. This is in case of those fetus, right? Newborns. Because the structure is to be developed. And because this structure, the baby has to grow. So that's why primary is laying the basic foundation. And this is temporary. What type of cartilage? Hyaline cartilage. Hyaline halos, right? Halos. Halos means it is like a halo. It is translucent. It is like a butter paper, right? Where light can pass, but shape cannot pass. So that is the typical characteristic of hyaline. So that's why under microscope, they would look very shiny. And we see the histology will be watching all of this. Just for a few minutes, let's stop messages. देख लीजिए पर समझ लीजिए. So this is primary. Primary is called synchondrosis, right? Synchondrosis. Chondro means cartilage, right? So this is synchondrosis. They will be eventually be converted into the bone when it will be calling it as synostosis. Ostosis. Ostosis means bones. Okay. So that is synostosis. The second type, which is called as the secondary one, right? They are called as the symphysis. Symphysis is joint. Now for this synostosis, something which is cartilage and later on it will become bone. Epiphyseal plate, right? Epiphyseal plate. When you take the X-rays of those newborn or X-rays of kids, it looks like the bone are divided into different parts. This is the shaft. Shaft is different. Then greater trochanter is different. The head is different. Lesser trochanter is separate. It looks like as if the bone is broken. Then gradually they start joining. So I'll be showing you one sequence of X-rays. Sequence of X-rays, right? As the age increases, कैसे वो joint होता जाता है, right? So this will give you the idea. But if you really see the bone तो is perfect ना. यहाँ पे सब कुछ है. But this is all cartilage. This is all cartilage, right? That cartilage. This is the cartilage which will later be getting converted into the bones, and that process is called as synostosis, right? This is the primary cartilaginous. Right? So what type of joint? That joint would be called as the primary cartilaginous joint. Epiphyseal plate, also called as the growing end. That is the epiphyseal plate.
Growth plate.
Growth plate. Growth plate. Then spheno-occipital. Sphenoid and occipital bone. Right? So when they meet, they are all these things. Right? Then chondrosternal or the sternocostal. This is the first chondrosternal. First means that is the first rib. Right? That first rib. It is forming what? Thoracic inlet. Right? Because that rib, is forming the thoracic inlet. Right? One side clavicle, back side there is scapula, and And this is the making. But as the baby grows, the thoracic inlet, it has to increase in size now, because bigger structures, they are coming up. The body, the thorax is increasing in size. When it is complete, then this is ossified. So till that point, it is of cartilage. So that is the sternocostal. Sternocostal means we are dealing with first chondrosternal. First chondro means cartilage, sternum means sternum, first rib. So first rib, which is cartilage, it gets converted into the bone. So there are several examples, so many examples, but these are some few. On to the secondary one, which is called as the symphysis. Classically, symphysis, this is for strength. Symphysis is for strength. One, the example of symphysis pubis. This is where in the pelvis, when both the bones, right side of pubis bone, left side of pubic bone, they meet, right? And this is what leads to formation of symphysis pubis. It is a joint, but there is not much of the movement. It's a very powerful joint because it is keeping the entire pelvis intact, correct? Then second one, see, wherever the strength is needed, manubrial sternum, manubrium, and then the sternum. So manubriosternal joint. So that ridge which you are feeling, that ridge, right? That is also a joint. So this is a manubriosternal joint. And then we do so much insult to our spine. All those things, right? But these intervertebral discs, they sustain for such a long duration. Only when it becomes extreme, then they go wrong. Otherwise, they give good, powerful support, right? So that is the intervertebral disc. So this is for today, right? Next time we'll be taking the synovial joint, plus I'll be showing you many of the X-rays. Right? Synovial joint is one of the vital joint. Right? And it's that there is so much to learn. So that's why we are not say taking it today. Right?
No, sir, it's okay.
So next time definitely we'll take that. ये क्या दोनों मेरे सिस्टर्स ना एक एचओडी है यानी एक कॉलेज में प्रिंसिपल है सो मेरा कोई क्लास ही नहीं ऑल राइट सो see you on Tuesday. Wish you all a very happy Raksha Bandhan
Thank you, sir. Same to you.
and
Thank
thank you so much.
you, sir.
And so,
Thank you, sir.
it's so good that at least more than 100 of you have come today. Thank you. Take care and bye bye.
Thank you, sir.
Thank you,
Thank
sir.
you, sir. Bye, sir.
Thank you, sir.
Bye.
Thank you, sir.
Bye bye. Thank you.